Hi, everyone. Welcome to the Sex and Wellness Podcast with Dr. Mary. Today, we have some great stuff coming up. I'm really excited to tell you guys and chat about some really interesting things that you may not know about your body. And we're going to be talking about pain with penetrative sex today. Before I dive in, I want to say thank you guys so much because it has been amazing since starting my podcast. This has been something I've been wanting to do for a long time, but quite frankly, I've been a little scared or intimidated by it all, especially, talking about sex can be uncomfortable, especially with my history of growing up in a really religious community and even in our society where it's taboo, right? But I just lean into it and understand that, hey, this is actually helping a lot of people, and it's uncomfortable for a lot of people to talk about until you start normalizing it. And so I just want to say again, thank you so much. All of the kind words everybody's been saying and the messages, I can't thank you guys enough. And so I would like some feedback from you all and understanding, are the interviews helpful? Would you prefer more solo podcast? What are some things that you like? My idea initially was more so, hey, let me add on some other people and talk about some things and have more of a dialogue. And I want to know kind of what's your feedback on that. And then this session, and I'll do occasionally some more solo dripped in with the interviews. I like the interviews because it's giving you access to information that you didn't have. And when I bring other pelvic floor therapists on here, I like it because it's more of a dialogue between the two of us in our experience. So that way you guys get jammed packed with all this great information so you can feel the best in your body. So let me know what you think about that, and any feedback is appreciated. I'm so new to all this and it's been quite a learning curve, but it's been awesome to have you guys along with this journey. And again, all of that feedback. So please share with your family and friends. And the more we can empower other women, the more strong we can be as a whole and really make really amazing decisions with our body and be really empowered with our health. So if you can, please give us a 5-star review on any of the platforms. So that way more and more people will see that this has been helpful to others. So now that I've said all that, we're going to dive in today about pain with penetrative sex. We had a 32-year-old female named Jen reach out from Omaha, Nebraska, and she was mentioning that she said that she had pain with penetrative sex and what can she do with it. And what I find about this topic is actually this is the number one reason people come to visit me in the clinic, pelvic floor related. And a lot of the times, I'd say 99% of the time when people come in, the conversations I'm having with them, they feel heard because they say, wow, I didn't even know, I don't even pay attention to some of these questions or my body in the way that I had no idea that I could pay attention to, if that makes sense. And I'm also asking questions about their sexual health when a majority of the time people mention that their healthcare practitioners have not at all. And so it's really important that you know that there are access to people that can help you and you're not broken. You just need some guidance on some things you can do to help you feel better and feel more empowered sexually. Because let's be honest, if everybody's having enjoyable sex, I think this world would be a lot less angry. But anyways, I digress. So we're going to dive into that. And then there's a bunch of different reasons why pain with sex can occur. And so we'll go ahead and jump right into those, but know that it's okay to ask your healthcare practitioner about sex and any form of sex. And if you feel unheard or you feel like, they're uncomfortable, it's okay to seek out an alternative provider, right? Somebody else that might listen or might not feel as uncomfortable. And unfortunately, it's just the way the training is in the United States that not many people, even healthcare practitioners, get a lot of sex ed. And, so we'll jump into the different causes of it. So pain with sex can really be broken down into a few different types. I would say the main types are going to be 1, with pain with initial penetration, 2, pain with deep penetration, and 3, the inability to have penetrative sex due to the pain, right? And so and then you can have pain with penetrative sex, with initial and deep penetration as well. So those can kind of be mixed in together, but we'll kind of break down the different causes of those. And you might be thinking, oh, I didn't realize that I was the only person that had pain with sex. Well, the American Gynecological Association, the ACOG, I think I just said it wrong, but ACOG, they say that 75% of women at some point in their life have had pain with sex. 75%. And of those people, I wonder how many just didn't say anything because it's been normalized that, okay, it just hurts, right? And also, I mean, this is something I've dealt with as well. Not been able to enjoy sex, having pain with it, feeling uncomfortable, not knowing what's going on down there, right? There's just so many factors. And so what we'll talk about next is really the initial penetration. So if you think about the vaginal opening, right? The vaginal opening is surrounded by a group of muscles, and they contract and relax. So also at the vaginal opening, we've got your urethra right there. You've also got the backside of the vaginal opening. That's often, if you've had a child and you tore, that's often where people will tear, on that backside closer to the anus. And so pain with initial penetration can be due to either scarring. So if you did have a child and you did tear, sometimes I'll see people postpartum and even years later still having that pain with initial penetration. And what I'll say with that is, they'll kind of describe it as, it feels like glass shard, like it just feels like glass. It's very painful and uncomfortable. And they may say that, I didn't have this before. I had no idea that this could even happen. And so not to worry, there's a lot we can do about that. Just think about the scar tissue, right? So scar tissue is basically when we have a scar or an incision or something like that, the tissue just becomes a lot thicker and it's not as mobile. And so most likely you were probably not told to move your vaginal scar. And moving it, and sometimes I'll have people massage it or use a dilator to slowly stretch the area out. Those can be some of the common reasons for that. And the next common reason can be due to estrogen deficiency. And so what does that mean, and how do you even know if you have it? Most people don't necessarily know they have a decrease in estrogen. Like the most common symptom of it would be vaginal dryness. But the reasons a decrease in estrogen can occur are due to prolonged oral birth control use can be one reason. Being postpartum. So if you're breastfeeding, that decreases the estrogen. If you're in perimenopause and menopause, and as well as a history of cancer treatment. So those are some of the causes of that decrease in estrogen. And so if you have a decrease in estrogen in that area, it's important that people talk to their OBGYNs to see if that's the right fit for them. What I do find is that there's really kind of two main ways that estrogen is given. It's like a little vaginal capsule, and then there's the tube, like a cream. I personally, for these situations, the cream can be great because the blood supply to the vaginal opening is different than deeper into the vagina. So if you have vaginal dryness and you want to get it deeper, you can use it's almost like a syringe, and you can fill it with the cream and shoot it up higher into the vagina. But if it's at the opening, sometimes people will describe it as kind of burning or just painful, and it does not feel good, maybe a little dry. I'll have them rub the cream that they've been prescribed on the vaginal opening. It's important that you spread the labia and then you put it on the vaginal opening, because that's a different blood supply than deeper into the vagina. And when you do this, like I said, make sure you're actually doing it on the vaginal opening. A lot of people put the cream on the labia. So that's the tissue surrounding the vagina that you need to spread to put the cream on. So just make sure that if you are doing this and you haven't seen results, I would check that out and see ask your practitioner where you should be putting it. So that's important from that aspect. The other thing that can cause this too is the other thing to note actually is you might notice a decrease of estrogen in your vagina if you have chronic infections. So sometimes chronic UTIs is a big one because, you've got the urethra so close to the vagina. So there's that. So if you irritate the urethra, right? So maybe just even like little nicks on the urethra potentially, because the skin is thinner, right? So when there's a decreased estrogen, the tissue is a lot thinner, a lot easier to kind of break down. And so sometimes that can cause UTIs from that standpoint. And so that's another episode where I talk about UTIs, but we break this down a little bit more, but just wanted to kind of mention that. So kind of dry, irritated, sensitive skin, repeated infections, things like that might be a sign of decreased estrogen. The other thing that can cause irritation at the vaginal opening can be the hymen. I've seen this more with people that recently started having penetrative sex. So, the hymen has this history of being the tissue that when it's broken, it's popping your cherry, which really is a load of shit because essentially it's just tissue and it doesn't matter if you've had penetrative sex or not. Sometimes the tissue just breaks apart. Sometimes it wasn't even closing the area. It's just extra tissue on the outside of the vagina. So if you ever look at your vulva and you see your vaginal opening, it's like little tissue that's kind of around the vaginal opening, sometimes deeper into it. And what I find is that this tissue it needs to be more pliable. It can become really sensitive. And so to desensitize that area, sometimes I'll have I'll talk with their healthcare practitioner about maybe getting lidocaine, because the best way to work on getting that tissue mobile is to kind of stretch it. But because of that, it can be painful. So sometimes the lidocaine can help with that. So if you're having that, you don't necessarily need to run to surgery to get a hymenectomy. I would say that's just removal of the hymen. I would say try this first. It often can get misdiagnosed. I've seen people, especially recently, that had been going to a practitioner over and over, and the reality was it ended up being the tissue because it was just pinpoint on that area, no other symptoms, just that, no history of changes in hormones or anything like that. And so we really targeted the area and really starting to focus on stretching it. So that's why the lidocaine can be helpful. And the other most common reason I see pain with initial penetration will be a change in vaginal pH. So we've talked about vaginal pH a few times over the past episodes, but if this is your first time listening, I'll dive into it a little bit more. So basically, your vaginal pH should be around 4. So we want it to be more acidic. And so there are certain things that can set off the vaginal pH and make it more sensitive, dry, and itchy. And that can be due to a variety of reasons. So it can be due to sometimes people are more sensitive to sugar. So I know for me, if I eat too much sugar, the area gets a little more itchy and irritated. And I love the way I'm like openly admitting this on a podcast, whatever. If it helps other people, I'm willing to talk about it. And so that's a big one, right? The next will be maybe using like if you're scrubbing your vulva, please do not scrub it. It's a very sensitive area. So when you're washing it, just let the water kind of rinse. Use a shower head, spray that area. You can use some light unscented soap. That can be helpful as well. And just slowly rinse it off. You don't need to scrub it because sometimes what that can do is break down the tissue and make it more irritated. Okay. Some other things to think about are just like lube, right? So some of these old school lubes that were really focused on men and not as much on the pH of the vagina. So I would say kind of look for more brands like Lola. Lola has some lube. You can also look for Mod is great, Good Clean Love. There's just a variety of different brands that you can use. And if you're unsure, you can kind of look at the products or talk to the customer service representative of the different companies and kind of see if they've check to see if it's safe and it's pH balanced. It's helpful for the vagina versus irritating it. So something to think about with that. Another thing is sitting in a wet bathing suit for a long period of time. That can irritate it. It can be so many different things. So something to think about with that. And for that, typically what I'll tell people is there's different types of oils or lotions that you can kind of put at the vaginal opening while you're waiting for that pH to restore. And you can test your vaginal pH. There's vaginal pH strips that you can get from Amazon, and you swab the inside of your vaginal wall and you rub it on the little pH strip, and it tells you what your pH is. And so if it's usually more than 4 to 4.5, that's when we'll recommend somebody taking like a hyaluronic acid suppository to help them with that as well. And so there's different brands for that. So those are the main top reasons why there's pain with initial penetration. And as we start getting into deep penetration, it shifts a little bit, right? Because I want us to dive back to the tension in the pelvic floor and how that relates to our nervous system. So again, a fight or flight response, when we're really stressed and we're in this go, go, go mode, what happens is our whole body stays tense, right? So it can stay really tense, and subsequently your pelvic floor muscles stay tense. So they're shaped like a bowl, right? And on the side of the bowl are your hip muscles as well. On the bottom are going to be the base of your pelvic floor. All those are muscles. And so if you're constantly in this state of fight or flight, being penetrated and having that area pressed on over and over again when it's really tight and irritated, it can be painful. It can be very painful. And so it's important that it can be tight because of that, right? And so if you are running around all day and then at the end of the day, your partner's there and you guys want some intimacy and you try to shift your brain out of work mode into play mode, it takes some more downtime to help with that, because for a lot of people, being in that stress mode suppresses our sexual desires, right? And it can be harder to relax those muscles because we're not thinking as much about sex as we are all the other things on our plate, right? And so that's something to kind of think about. So maybe thinking of some downtime or just some diaphragmatic breathing, which helps to calm down your nervous system and relax those pelvic floor muscles, because your diaphragm is at the base of your ribs. And as you inhale, the diaphragm pushes down and then the pelvic floor lengthens. And as you exhale, the diaphragm comes up and the pelvic floor contractions. So they work together, and that helps relax the pelvic floor muscles, and it helps relax your nervous system, which will relax all your muscles in your body. Other thing that can cause that too is just chronic hip pain. Hip or low back or SI joint pain, because again, all those muscles are the same muscles of the pelvis, very similar muscles, and they connect from the hip to the pelvic floor to the pelvis. They're all kind of intertwined there. And so if you're chronically having a hip issue and you're maybe only noticing pain on one side and not the other, that could potentially be the case. Usually if you are experiencing a lot of pain just in general, with most positions, it might be an overall hypertonic floor, or if it's just in certain positions, it could be due to certain muscles being tight. And usually you would look at hip motion and things like that to kind of see what's going on. The way we would treat that is typically, I would assess intravaginally to kind of see where those muscles are, show people how to connect to their pelvic floor. So pushing on those muscles, having them breathe through their lower ribs and belly. And I don't spend a ton of time internal because I want people to understand their bodies and control this themselves, because that's what's going to take them to that next level. I do see, unfortunately, a lot of pelvic floor practices of people coming in, having an internal treatment and leaving, and just kind of on repeat. And I do believe that's a disservice just because people aren't learning as much about how to relax their pelvic floor muscles or understanding why they're tight in the first place. So if you feel like you've been kind of doing the same thing over and over, it could be something to kind of look for some extra help in understanding the why, right? I like to treat the cause, so the why, and also the symptoms. And so another way that, if say it's a specific area, there are vaginal wands that you can use to kind of push on those muscles to help relax them yourself. And then starting to recognize when you're in that fight or flight response and just kind of checking in with your body and thinking, oh, I didn't realize that I'm this tense when I do XYZ. You can also know too, if you're tensing your jaw, you're likely tensing your pelvic floor because there's that connection. So just kind of focusing on relaxing your jaw, and that can help relax the pelvic floor. Don't worry. A lot of people feel disconnected from their pelvic floor, and that's okay. I mean, you never really learn. So try to be a little more gentle on yourself because you're learning a lot of really cool stuff about your body, and it takes time. I felt disconnected from my pelvic floor and my vulva just because I didn't know what I was supposed to know. I just thought it was an area that nobody talked about. And the more you understand your body and your genitals and the lower abdomen and your pelvic floor, the more empowered you are with your body, right? And so that can be really, really helpful. And so that's another common reason why those areas can be tight with deeper penetration. The other reason it can be due to prolapse. So sometimes if you have pelvic organ prolapse, you either have, the most common ones that I see are rectal prolapse or bladder. So basically either one kind of fall into the vaginal wall. And so sometimes, depending on your prolapse type, a lot of people have prolapse, by the way, and there's a lot you can do about it. So it sounds really scary, which it is, especially when it's your own body, but there's just so much that can be done. And I actually had somebody come in the other day and was told to almost immediately have surgery for their prolapse and was told to stop lifting weights and do all these things. And the reality was the weightlifting isn't what was increasing their symptoms. The external stressors where they would hold their breath or clench, those types of things actually kind of increase some of her symptoms. So just because you're told you need surgery, I highly recommend that you talk to a pelvic floor physical therapist, because it doesn't necessarily mean you need surgery. Either way, it's really good to see a pelvic floor PT because it's going to help you either way, whether you decide to have surgery or not. But I would say a majority of people with prolapse, it's usually a minor or slight, but you can still have a lot of symptoms with a smaller prolapse. And I would highly recommend trying pelvic floor physical therapy first before committing to any surgery, because it's a big surgery and it's a few weeks of recovery, just kind of getting back on your feet and then doing rehab again. So either way, you would likely do rehab. Although sometimes people, unfortunately, aren't even referred to pelvic floor physical therapy after a major surgery like that, which I believe is a huge disservice. And that's why I'm on this podcast, to really empower people so they know, oh, I know that this is an option because I heard it on a podcast by this crazy lady that talks about vulvas all the time. So there's that aspect too. And so, so if there's pain with sex in different positions, you could kind of start noticing, oh, if it's, in a certain position, you notice that pain, it could be in line with either where the prolapse is. And the great way to kind of help with that is sometimes to have people, do some breath work or invert, maybe put a pillow under their hips to kind of take the pressure off the pelvic floor. So that way those pelvic organs can kind of pull back away from the vaginal opening. Maybe doing that prior to having penetrative sex, different things like that. But again, that's just kind of like a very general idea, but there's a lot in pelvic floor that can be done, but that could be potentially one of the causes as well. The great thing about this is there's just so much to learn, and I just get so excited to empower people because I don't know. I just think it's crazy how much we don't talk about this. And I could go down a whole rabbit hole, but there's been a huge disservice to women in the healthcare industry. And my whole goal is to really change that. And hopefully, providing guys with this education will. Anyways, another reason why I find there's pain with sex is there's not enough clitoral stimulation prior to intercourse. And I blame this on pornography, TV, all these different things, right? Because we're not seeing an accurate representation of sex. Okay. So typically you'll see two people just kissing, and then all of a sudden penis and vagina, and then she has some crazy orgasm, and then he does too, and then they move on like nothing happened. That's not accurate at all, because that person, the majority of people that climax with penetration alone is like, I want to say it's definitely less than 10%. A majority of women can consistently achieve orgasm through clitoral stimulation. If you're not sure if you've had an orgasm or you don't know how to have one, I'd highly recommend just kind of exploring your body and just seeing what feels good and what doesn't. And then, just kind of exploring it that way. And so then that way you can explain to your partner what you want. And everybody likes different stimulation, right? So maybe if you like a certain type of clitoral stimulation, mention that to your partner and show them what you're doing, because everybody's body is different. Everybody has different nerve endings. Everybody has different muscles. I don't know if it was just from those like 90s or 2000 teenage shows where we just assume the partner is supposed to know exactly what to do. And it's just bullshit, because there's just no way anybody can know. If think about the anatomy of our bodies, everybody is so different, right? So you might like something different than another person. And so communicating that to your partner, but then also understanding the physiology of an aroused vagina. So basically, if the vagina is aroused, the vaginal opening widens, and the uterus and cervix pull up. So it allows for that penetration. So you can see physiologically, if you are not aroused, you would likely have pain with penetrative sex, because the blood flow is not getting to the genitals. That separation, that relaxation of the muscles and the pulling up of the uterus is not happening, right? And so you can find that there's that big disconnect. And, try not to be too hard on yourselves. I hear this a lot where, oh, I had no idea. I just thought that I was abnormal. You are not. You are not at all. We were just not informed. And so, like I said, be gentle with yourself. You are not alone. But another thing that I can find is if you're tense and not feeling comfortable in your body. So I have a ton of conversations with women talking about how they're embarrassed about their vulvas and they don't want their partner to see it. And I am here to tell you that every vulva is different. Some labias are longer than others. Some are, one labia is longer than the other. Some are smaller, some are bigger, some are different, all different types, right? And so I can guarantee you the likelihood of anybody, another example is if you pull up a vulva or any of the anatomy books, they always look like so perfect, and it doesn't look that way. And it's just not reality. So everybody's vulva is different. And it's also, just kind of recognizing that you are beautiful the way that you are. It's just that we've somehow not learned that. And your vulva is not going to look like an anatomy book. It's not going to look like pornography. It's not going to look like somebody after vaginoplasty. There's just so many different things, right? And so understanding that can kind of creep in too, because those insecurities about our body can make us feel tense and just not enjoying the moment. And so what I would say is kind of diving in and kind of figuring out which one of these resonates with you. A lot of times it's all of them. But just thinking about it from that perspective, what are these like inner thoughts, these subconscious thoughts that are creeping around in your brain and saying these negative things to you? Is that what's tensing you up? Is it because of things you've been told? Is it, whatever it is, we need to kind of work to undo some of those subconscious thoughts that we have. And another reason we can have pain with sex is due to sexual trauma. And unfortunately, this is very common, and it's horrible. And a lot of innocent women have been affected by this. And what happens is, your body kind of goes into that trauma response and the muscles tense up. And I highly recommend, if this is the case, seeking help with a psychotherapist to help you process the trauma and then help you with regulating your nervous system to help your muscles not be in this fight or flight state, right? And I'm not a psychotherapist, so I work a lot with psychotherapists because I work with the body's symptoms based on the person that they're presenting with. I'm not qualified to work through somebody's trauma because I'm not a psychotherapist. So those are some things to kind of think about from that perspective. The other thing too that can be common is it's called vaginismus. And vaginismus is the inability to have penetrative sex. And this can happen for a variety of different reasons. The most common reasons I found this are again, vaginal birth. So tearing and then being stitched up too tight, which please, if somebody is giving you the husband stitch, just tell them no. I mean, I don't hear about it as often in Austin, but I'm sure there's other places in the world that are doing it. And no, it is not serving. It's not going to serve anybody because it doesn't help. It's just tightening the tissues up, and then it can be more painful for the person that just had the child. So I'd highly recommend avoiding that if possible. But you may progress faster than somebody who has not been able to have penetrative sex. And so just there's that aspect because it's more of a situation due to stitching and scarring. While on the other hand, I've seen the inability to have penetrative sex due to sexual trauma as well as religious trauma. And I'm going to have a psychotherapist on here that's a sex therapist to kind of talk about purity culture and how that affects us pretty significantly. And I've seen this with a lot of people that either based on their religion, they want to wait to have intimacy or penetrative sex until they're married, or they grew up in a highly religious community and then they were told, it was shameful to have sex and a woman shouldn't look a certain way and a bunch of different things, right? So then we internalize that, and then there's a lot of a fear-based response around that. The pelvic floor muscles get tense. There's a lot more involved because of that history. And what I've seen too is that people are told in their certain religions not to have sex before marriage, but then what happens after marriage, because they were so scared of it prior that all of a sudden a switch is supposed to go off and all of a sudden it's supposed to be okay. This is why fear-based education is not good, regardless of your religion. I get it, right? I understand that everybody has a different religion, but coming at it from helping somebody understand sex and then letting them make their decisions, because what it does is it just takes time to kind of undo that. And just again, being patient with yourself, because it's going to take some time to kind of undo that. So again, highly recommend psychotherapy to kind of work through the trauma to help you. And then once you've worked with a therapist and kind of you start understanding and working with through your trauma, then a pelvic floor PT can be really helpful and to kind of work together. And so that's just a typical way that might look. And so sometimes it can take months, right? Sometimes it can take a year, sometimes it can take less, more or less, just depending on your history, right? So I don't want to give you a timeline because maybe it can take longer than that. I just want you to know that this will potentially take a little bit longer than somebody that maybe has pain or dryness at the vaginal opening, which, can be adjusted by the things that we talked about before. So again, there's a lot you can do. There's dilators for that. There's, pelvic floor stretches. There's diaphragmatic breathing. There's hip mobility. There's a lot of different things. And then you slowly start kind of involving your partner with it. You have to feel safe in your body first with the pelvic floor physical therapy aspect. And then I do find that as the person can use the dilators more, it's then adding in the partner component and helping them work together on it, because there's this fear around the pain, or it can be triggering for the person. So again, something to kind of think about from that standpoint. And it can definitely be helped. You are, again, not alone. And I know that a lot of people I've treated that have this, they do feel alone. And there's a fear of, there's inability to have pap smears because of it. There's the fear of, am I ever going to have a child? Can I have a child? Is the only way going to be IVF? There's just a lot to process there. And there's, again, so many reasons why all these things can occur, but I'm just giving you the explanation based on just kind of some general information, right? And so I want to add to all of this is that penetrative sex is not the end all be all, right? A majority of vulva owners will experience their orgasm with clitoral stimulation. Like I said, a very small amount will have orgasms with penetrative sex alone. You can have clitoral stimulation and then orgasm with penetrative sex, but that likely may be more of the clitoris and urethra nerve endings together. It may or may not be, right? But the point is everybody's vulva is different. Everybody's orgasms are different. And just starting to understand that, right? And like I said, penetrative sex is not the end all be all. For some reason, we've been taught that. And the reality is, there's like this elusive orgasm gap between men and women. And the reality is a majority of women or vulva owners with masturbation, can experience orgasm. So there's really no gap. It's just that the communication isn't there, and we're not talking to each other. We're not even taught how to talk to each other. So please don't fake orgasms. Try to have this conversation with your partner. It can be an open dialogue. It can be uncomfortable. But the more you do it, the more you lean into it, the easier it becomes. Like I said, I didn't feel comfortable talking about sex. I had pain with sex. I just didn't feel comfortable with any of it. And then the more I educated myself, the more I learned about my body, the more comfortable I felt. And I felt really empowered. But I've also had to overcome a lot of religious shame, religious guilt, right? I've had to, growing up and being told, a woman's body is supposed to be covered. If somebody touches you or says something, it's your fault, right? Because you dressed a certain way. And I still have to undo some of those things, right? But overall, the fact that I can be here today talking to you guys about this and feeling empowered in my body, sexually, physically, and emotionally, you can definitely do it. I mean, you can. And I just know that, like I said, the more that we learn, the better. So in summary, really think about if you are having pain with sex based on everything I just said. Let me know, just think about it and think about, okay, which areas, right? Then you can start asking your healthcare practitioners about the symptoms, right? And even if you don't have access to a pelvic floor physical therapist, there's a huge need still. There's a ton of resources. Like I said, my podcast, there's also telehealth physical therapy. So there's people that could see you through that, but know that you are not alone and you can do this. And so thank you guys so much. I was really excited about doing this solo podcast. Again, tell me what you think. And then follow my Instagram at drmarypt. So Dr. Mary PT. And give us a 5-star review on whatever platform you're using. Thank you so much.